pense que nous avons quelques problèmes techniques, mais je vais essayer de redire ce que j'avais dit. Je m'appelle Patrick Musavuli, je travaille pour le secrétariat de la Convention et mon rôle aujourd'hui sera de modérer ce webinaire. Donc, je remercie professeur Jeff Drope pour l'invitation, d'avoir invité le secrétariat à ce webinaire. Et mon rôle aujourd'hui sera naturellement de modérer cette réunion. Désolé pour les couacs du début, c'est comme ça avec la technologie, mais avec le temps, je pense que nous allons nous rattraper. Et donc, avant de commencer, il y a quelques informations clés que je voudrais partager avec vous. Comme vous l'avez sûrement remarqué, le webinaire va se tenir en 2 langues. Donc, nous avons prévu l'interprétation en anglais et en français. S'il vous plaît, regardez au bas de l'écran et vous pouvez cliquer sur la langue de votre choix. Et bien sûr, assurez-vous que le son est coupé. La deuxième information que nous voulons partager avec vous, c'est l'utilisation de la fonction Q&A. Cette fonction sera disponible pour vous si vous avez des questions à adresser aux présentateurs. N'hésitez pas à utiliser cette fonction. Nous serons ravis de voir vos questions. Veuillez les envoyer pendant que les orateurs font leur présentation et ils seront heureux d'y répondre pendant la session questions et réponses après toutes les présentations. Alors, il y a aussi la fonction chat que vous pouvez utiliser. Cette fonction, vous allez l'utiliser pour des problèmes éventuels. Si vous avez, par exemple, un problème d'interprétation, n'hésitez pas à écrire dans la fonction chat. Voilà. Alors, comme vous le savez peut-être, depuis le 15 décembre 2020, Tobacconomics a publié la première édition du tableau de bord international des taxes sur les cigarettes, qui évalue la performance des politiques fiscales sur les cigarettes dans plus de 170 pays. La tax scorecard de Tobacconomics évalue les performances des politiques de taxation sur une échelle de 5 points en utilisant les données des rapports mondiaux de l'OMS sur l'épidémie du tabagisme, fournissant ainsi aux décideurs politiques une évaluation exploitable de la politique de taxation des cigarettes de leur pays. Le tableau de bord montre que dans l'ensemble, la plupart des pays du monde ne parviennent pas à taxer efficacement les cigarettes. Près de la moitié d'entre eux ont obtenu moins de 2 points sur 5, avec peu d'amélioration entre 2014 et 2018. La région où les politiques de taxation des cigarettes sont les plus fortes est l'Europe. Néanmoins, la région a obtenu un peu plus de la moitié des scores possibles. Et il faut noter que la région africaine a été la moins performante, relevant ainsi un potentiel inexploité considérable pour augmenter les taxes et sauver des vies. Alors, vous allez justement comprendre qu'à partir de là, nous avons un objectif assez clair pour ce webinaire. Ce webinaire permettra de mettre en lumière les principaux aspects de la taxation sur le produit de tabac dans la région, en donnant les exemples de réussite, les résultats du tableau de bord régional de la taxation de cigarettes en Afrique subsaharienne, mais aussi le nouveau manuel d'administration des taxes sur le tabac, la manière d'accéder à un soutien pour améliorer la taxation de tabac. Au cours de ce webinaire, donc aujourd'hui, nous aurons l'avantage de recevoir des informations de la part des experts de Tobacconomics, de l'Université de Cape Town, de l'Organisation mondiale de la santé, le siège, et l'OMS AFRO. Tous ces experts vont discuter de la taxation et vont donner des exemples assez concrets. Alors, sans plus tarder, je vais inviter notre premier orateur, qui n'est autre que le docteur William Maina. Dr William Maina est un expert de santé publique qui travaille en tant que responsable de projet au niveau du bureau régional de l'OMS en Afrique. Il coordonne le projet Bill and Melinda Gates et Dr William a une longue expérience dans la lutte anti-tabac. Dr William Maina, vous avez la parole pour nous parler nous donner un bref aperçu sur la taxation de produits de tabac en Afrique. Dr William, vous avez la parole.
Thank you so much, Patrick, for the introduction. I'm going straight into my presentation. Basically, I am going to focus on WHO work on tobacco taxation in the WHO Region Office for Africa. And my presentation, I'm going just to look at why it's important to have tobacco taxation. Also look at the objectives of WHO tax work in the African region. And finally, run through some of the how we do it so that the participants can understand how WHO comes in and where we can engage in terms of knowing the approaches that WHO takes in order to provide technical support to its member states in the African region. And finally, I'll just make a few remarks towards the end of this presentation. Next. Why WHO does tobacco tax work is not just because it is part of the Framework Convention on Tobacco Control, but because we do believe that tobacco taxation is good for public health, mainly because it reduces initiation and of tobacco use and increases chances of quitting. Tobacco taxation reduces consumption for current users and prevents ex-users from restarting use again. And we know that a reduction in tobacco use leads to reduction in risk factor for non-communicable diseases. Number two is that tobacco taxation is good for the economy. And I think most of the presentations that will be following this will highlight a bit in details and deep in depth about the issue of tobacco and economics. But we know broadly that tobacco taxation improves health status of the population, of the citizens, and therefore reduces the health cost. This is a saving to government and to individuals. It also increases government taxes as well as enabling government to allocate the saved revenue to meet the cost of other health programs within the country. Next slide. What are the objectives of WHO tax work in the African region? Firstly is to support member states to reform their tax policies. And this is basically to ensure that there's progressive increase in tobacco tax, and to the extent that there is increase in tobacco prices so as to reduce affordability and therefore reduce the demand. Number two is to improve the tax administration, and basically is to prevent the loss of revenue from government and also prevent illicit trade. And this also focuses on making tobacco taxes more efficient and effective at the government level. And finally is to ensure that using tobacco taxation, we are able to support government to come up with mechanisms to put in place measures to secure sustainable domestic resources for tobacco control and other health programs. Next slide. How do we do it? We have two approaches as WHO. The first one is high-level engagement. And WHO is able to engage at a ministerial level, where we are able to sit with the ministers of finance, ministers of planning, and the ministers of health, and actually engage with them and explain the importance of tobacco taxation in order for them to support policy change. Number two is where we engage at the technical level with the decision makers at the policy levels, and basically we meet with directors of health, directors of tax policy, and directors of budget and planning within the ministries of finance. These are very important because these are the experts within government who make decisions on the kind of tax policies that they are going to formulate every time they are reviewing or even reforming their tax policies within government. And finally is the engagement with regional economic blocs, where we look at countries with common interest, and we are able to engage with economic blocs and assist such blocs to review or even come up with policies that are promoting tobacco taxation. A good example of one of the blocs that we engage with is ECOWAS and more, where we've been able to engage with them and assist them to come up with the tobacco tax directives that countries are applying to improve their tax policies at the country level. Next. Besides the engagement at the high policy level, WHO is also involved in the technical work. And basically what we do is to build the capacity of technical experts while providing them with normative guidance when they are developing policies for tobacco taxation. And what we normally do is, first of all, is to ensure that the ministries of finance are able to come up with the experts in the tobacco tax technical working groups. These groups are very essential because they drive the process and they own the processes of tobacco policy change within the ministries of finance. And once these committees or teams are formed, we do carry out capacity building for them to understand what are tobacco tax policy reforms that are required, the issue of tax administration, and at times we even build their capacity in a broader tobacco control issue so that the ministries of finance can embrace tax reforms as a way of achieving or meeting public health objectives. And the other thing we do with countries is to actually support them to collect data and information, analyze this data, and then come up with the deductions that support to elaborate tax proposals. And in our case, we apply the WHO tax simulation model. Next. This work is carried out within the framework of a comprehensive tobacco control. And therefore, tobacco tax work is a major component of comprehensive tobacco control. This is because we all know that tobacco taxation is the most sustainable and the most economically viable way of tobacco control. And we look at it from the point of low development to the far end of implementation of policy. And tobacco becomes very, very key because within the tobacco policy reforms, there is a low development because countries have to develop and adopt excise tax policies and laws. And from that point, they have to implement them. And after doing this, then we expect end results to be increase in revenue, reduction in consumption, and savings in health. And therefore, it's a mechanism of, at the end of the day, achieving sustainable domestic resources for tobacco control. Next slide. This task is not easy. There are so many barriers to progress in this work. First, we know that the tobacco industry is always opposing every effort. And I think we are going to look at to see this in our subsequent presentations. The industry is always opposing the tobacco taxation with so many claims, what we call the scare tactics. And the same case, at the same time, we know that the focus of the ministries of finance in tax work is not public health objectives. Their main focus is usually revenue and finance-related issues. And therefore, as health experts, we always face an upward task trying to promote tobacco taxation work. And therefore, it's an area that requires a lot of multi-sectoral action. And we found that in countries where there is embracement of multi-sectoral work, particularly where we have a national multi-sectoral coordination mechanism, it has helped in order to support different sectors that are not health sectors to understand why their role is important in terms of contributing to tobacco control. And despite all the hardships and difficulties in trying to promote reforms in tax policies, we have achieved remarkable progress in the African region. And I think the aim of this workshop and meeting will be to discuss some of the successes and challenges that we have found. But let me just highlight a few. Next slide. We have seen a transformation of a excise tax share of total price, and Patrick has just mentioned this in his introductory remarks. That's such that if you compare what was happening in 2014 and what was happening last year, we have seen progressively an increase in the number of countries that actually have attained the share of tax of tobacco products to the price over 35% and going forward. And however, we see that there is the range of the proportion of the share of the excise tax to the total price. It varies from country to country and differs from one sub-regional to the other. Next slide. At the same time, we have found that there has been remarkable reforms in tax structures in the African region. If you look at what was happening in 2014, you find that we had 23 countries that were actually applying pure ad valorem systems, which have reduced to 19. And when you look at the specific or mixed systems, we had 19 in 2014, and they have risen to 25. We normally recommend that country diminish, they move from ad valorem to specific taxation, because this has more impact on pricing and the affordability. And I think the experts who will speak after me are going to actually emphasize on this. Well, at the same time, we have seen a reduction in the countries that have tiers in their tax policies, reduced from 9 to 6. And this is the direction that we are going, because we are actually promoting the support to countries so that they can actually make their tax systems as simpler and easy to apply as possible, by actually reducing the number of tiers in their taxation bands to make taxation administration much easier. I think this is my overview of what WHO is doing in the African region, and I want to thank you for listening to me. Over to you.
Merci beaucoup, Dr. Maina, pour cette présentation. Nous avons tous compris que le bureau régional de l'OMS en Afrique est en train de fournir beaucoup d'efforts pour appuyer les pays à avancer avec la taxation sur les produits de tabac. Vous nous avez donné plusieurs exemples, hein, notamment vos interactions avec non seulement les ministères des Finances au niveau national, mais au niveau régional aussi, sous-régional, avec des organisations comme l'UMOA, la CEDEAO, et il y a eu des résultats, comme vous nous l'avez dit. Et vous avez insisté sur l'importance de renforcement de capacité, mais aussi vous avez donné un secret. Hein. Dans les pays où cela a semblé vraiment bien marcher, la multisectorialité a été l'une des clés. Donc, quand il y a un comité multisectoriel établi et qui fonctionne, c'est plus facile aux collègues du ministère de la Santé de travailler avec les collègues du ministère des Finances. Alors, n'hésitez pas, si vous avez déjà des questions, chers participants, partagez ces questions dans la fonction questions et réponses, Q&A, et Dr. William Maina se fera le plaisir d'y répondre. Sans plus tarder, je vais passer la parole au Dr. Jeffrey Drope, qui est professeur et chercheur à l'École de santé publique de l'Université de l'Illinois à Chicago. Ses travaux sur la lutte anti-tabac portent notamment sur la taxation du tabac, le commerce illicite des produits de tabac, la science et la réglementation des nouveaux produits de tabac. Professeur Jeff Drope est auteur et éditeur de 3 livres et de plus de 125 articles. Il n'est plus à présenter dans le domaine de la lutte anti-tabac. Dr. Jeff, vous avez la parole. Merci.
Thanks so much, Patrick. It's a great pleasure to be here, and I thank everyone for joining us today. And I think my presentation will complement quite nicely what Dr. Maina has just discussed. Today, I'm going to actually go over some of the results from our recent Tobacconomics Cigarette Tax Scorecard, in which we actually got very deeply into the very important particulars of successful excise taxation of cigarettes across the world. And of course, this would include the African region. Next slide, please. Our tax scorecard really focuses on key dimensions, and the key dimensions from our perspective and those of the many expert reviewers that we had help us with the scorecard are price, as one might expect, changes in cigarette affordability over time, the share of taxes of the retail cigarette price, and then of course tax structure, something that Dr. Maina talked about quite a bit a few moments ago. Next slide. We actually use data from the WHO's biennial reports on global tobacco epidemic. We use these because the data are excellent. They're both transparent and they're consistent, and we were able to use multiple time periods. And we're about to add 2020 because we understand that those data will be released momentarily in the next month or so. I'll talk about each of these specific component parts in succession, try to explain what they're about each. So next one, please. So the first one is cigarette prices. We know that across countries and across time, higher prices generally lead to lower consumption. So the goal of taxing is actually to drive up price. Next slide, please. This is really well enshrined in the literature. There's a vast body of literature, again, across multiple countries, regions, across time periods. We see that this relationship really holds true. This is a really great resource, by the way. This is the NCI WHO monograph on the economics of tobacco and tobacco control. And if you're really looking for a solid resource that actually goes to all other resources, or many, at least up until the point of time of writing it, it is an outstanding resource. Next slide, please. So we actually look at the purchasing power parity price for the most sold brands of cigarettes. And we actually looked at the distribution of prices across countries. And we also tried to set the high level benchmark, a score of 5 out of 5, as one where we saw the prices were really truly affecting consumption in a very major way. And we saw that that threshold was 10 international dollars or higher. And then we saw the distribution was relatively well distributed below that in increments of 2. And so that is how we ended up with this scoring rubric. Next slide, please. Here is the distribution of African countries on cigarette price scores. And as you can see, we've got a ways to go here. The average score for this component is 1.49 out of 5. The Seychelles is the only country we can see up there in the top right that scored a maximum of 5 points. And we can see there's a huge cluster of countries down, not at the very bottom, but next to the very bottom. And so what this suggests to us is that prices are very low across the region. And this is contributing to higher smoking prevalence. And I think worse yet, perhaps, is what we're seeing is growing prevalence in some countries, which is, of course, of major concern. Next slide, please. The next component area is cigarette affordability, and specifically the change in affordability. And what we know is it's not just price, but also income that affects the amount of consumption. So what this affordability score does is we actually are able to incorporate both changes in price and changes in income. So as people's income go up, they're able to buy more, the same way that when prices go up, they're able to buy less. And so when you put the two things together, we actually get probably a more realistic interpretation of what's going on in terms of consumption. And what we really are looking for also is this change over time, because what we find is consumers react to changes in affordability. So as products become less affordable, they buy less of it. So you've got all of these complex dynamics going on. And again, there is a very solid literature that demonstrates very well how important affordability is. Next page, please. So you actually see that this is enshrined in the FCTC Article 6 guidelines. And I'll just read the highlighted portion there: to make tobacco products less affordable over time in order to reduce consumption and prevalence. We know this works, and so we make this a goal, and it is an explicit goal of the Article 6 guidelines. Next slide, please. So this is the rubric for our change in affordability. And again, what we looked for was a distribution of these scores. And again, setting the high water benchmark at 5, we were really looking for the countries where we could see unequivocally that this change in affordability was affecting consumption. And so what we see here is that a 7.5% annual change or higher. This is an average annual change over the 6 years previous, so prior to 2018, which was the last year of the data. And so you can see that's a pretty high benchmark. That's quite a large effect on affordability. And then you can see it goes down the ladder here and down to 0, which is actually meaning that cigarettes became more affordable, which is of course the opposite of what we want. Next slide, please. So with that in mind, we can see that we are clustered at 0. We have in fact, this is the component score in the region where the average score is the lowest at 0.7 out of 5. And as you can see, this is being driven by all of these countries where cigarettes are becoming more affordable. And as I said, part of this is being driven by an increase in income. And this is a good thing. We want incomes to increase. That's generally actually a good sign in these countries. But we also really have to reinforce with our colleagues at Ministries of Finance that we really need to make sure that we're keeping up with those income changes. So you need to be able to tailor your excise tax policy to make sure that you're accommodating this change in economic growth. It's very, very important, especially in a region like Africa. Next slide, please. The next component is the cigarette tax share. We typically see that the higher the share of price that are taxes, the greater the positive health and revenue effects. As well, we see that when the tax share is higher, we know that the government is actually reaping many more of the rewards in terms of higher revenues. So if you had high price without high tax share, what you're actually seeing is the industry reaping all of those benefits. And we would rather that governments get to reap the benefits of higher prices through higher taxation. Next slide, please. This has been a long time, a standard recommendation. This started more than 20 years ago with a seminal World Bank publication called Curbing the Epidemic, where it was suggested that a tax account, if tax accounts for 2/3 to 4/5 of the retail price, we're going to do a lot better in terms of affecting price and getting those consumption effects for public health. Next slide. Not to give away my colleague's presentation next, Dr. Jeremias Paul, but the technical manual on the tobacco tax has also enshrined these levels, and you can see that they are very important across consistently across different sets of recommendations. Next slide, please. This rubric's pretty simple. Again, we set it 70% excise tax of price, and we like excise tax, I suppose, more because we know that it is going to affect the price of tobacco products more in comparison to other goods, as opposed to total tax share, which is of course also very important because it incorporates all of the other taxes, VAT, sales tax, etc. The difference here is that when those taxes go up, prices on all goods typically go up. So that's why we really emphasize this excise tax share. But the score is actually a combination of the two of them, meeting both the 75 total tax share and the 70 excise tax share. Next slide, please. Again, we can see that we have some low scores here, which is again, a marvelous opportunity here, and I call it money left on the table, right? This is really suggesting to us that these shares are too low, and that this is money that revenue authorities are leaving on the table that they are not getting, and very much a lot of the time, what we're seeing is that the industry will go ahead and price to their advantage and their profits. The average score here was 0.81, so it was the second lowest of the component scores. And as you can see, we have 21 countries scoring a 0 and only 1 scoring a 5. Again, tremendous room for opportunity, but definitely a place in which we are lagging in the region. Next slide, please. The fourth and final component is the tax structure, and we include the tax structure because, of course, it is the foundation upon which we build. Dr. Maina talked a little bit about it, and we have actually seen some improvements in this area in the region. Next slide, please. We're really generally counseling as simple a system as possible. Generally, we prefer a uniform specific excise tax system with regular adjustments for inflation and economic growth. We think this is the easiest to administer, and we think it's typically having the largest effects on price and therefore consumption. There are some hybrid systems that can work if they're done carefully. I won't get into the details here, but again, generally less is more here as long as it is done well and that it is enforced well. Next slide, please. As I said, the highest score is going to be those uniform specific excise taxes with the adjustments, or a mixed system that relies more on these specific taxes. And then you can see it goes down to the very last one, where if you obviously have no tax, which unfortunately some countries do not yet have taxes, you would score a 0. We also very much discourage tiered systems where there are different taxes for different brands or different products. We find these to be not only inefficient, but we see that the industry manipulates them to pay less tax, and we see much less effect on price. Next, please. Again, we see better performance here. We see much more cluster in the middle. So this is really encouraging. And I look at this as foundational. We can build on this. We have something to work with here. Obviously, there's still room for improvement to get up to that level that we see in South Africa. So we are really very excited about the possibility of more improvement in this area, as Dr. Maina had already suggested. Next slide, please. We could see scores over time changing among these component prices. You can see in 3 just increase. So slowly in the right direction. We see a little decline, sadly, in affordability change. So that's something to keep our eye on. And then we can see, of course, overall score has also increased a tiny bit over the last 6 to 8 years. So we're getting a little bit better, but we have a ways to go. Next slide. Let me just go over the overall scores a little bit very briefly before I sum up. Next slide, please. We can see this is a map of the world. The darker colors are the highest scores for overall tax scores. We can see some dark colors, Ecuador, Australia, New Zealand. So we have some high performing countries. We see probably too many light colors for our liking in Africa. So again, let's look at this as an opportunity and a place where we can all put our efforts together in order to improve tobacco excise taxation. Next slide. This gives a little bit of perspective comparing WHO regions. We can see that Africa is the lowest region of all of the WHO regions in terms of average score, 1.36, as I said before. And then we can also see on the far right side there, income groups, World Bank income group scores. You can see that low income and low and middle income countries, or sorry, low middle income countries are the lowest. These tend to be most countries in Africa. So again, we can see the great possibilities here for change. Next slide. Here is an illustration of the highest performing countries in the world, Australia and New Zealand. You can see they're awfully close to 5s across the board. They still have a little place to go and are actually trying very hard to continue to affect affordability, for example. But we can see that they actually outperform even most other high income countries and really quite dwarf the global average. And what we see in these countries is high taxes, high prices, and declining consumption, which is exactly what we would like to see and could see anywhere where these types of tax policies are implemented successfully. Next slide, please. Next one as well. There are some limitations. I won't get into them too deeply. We obviously only have enough data to look at cigarettes. I know in some countries in the region, there are some other products that are being used. We're working on this, and we hope in future iterations of the scorecard, we'll be able to accommodate this. We use most sold brand. There's an argument that we could use cheapest brand. Again, the problem is data. And again, as we start to get better data, we will really start to try to improve these. Next slide. And then, sorry, last slide. I think this really speaks for itself. As I said, there is untapped potential here in the region. We really encourage African governments to use significant tax increases so that they can substantially raise the price of cigarettes. We need to reduce affordability. Again, this is going to happen by raising these excise taxes, but it has to be done in a regular fashion, or we're going to see these affordability issues that we're already seeing in the region where cigarettes are becoming more affordable. As I also pointed out, tax share is too low. Countries simply aren't getting the revenue rewards that they should be getting. And I'll tell you that the industry won't blink an eyelash. They will go and raise those prices to increase their profits. So governments might as well take those revenues, because we could really use them, especially in the time of COVID-19 when we're trying to build back better. And then finally, we're making progress in terms of tax structures, but I really want to encourage countries to aim for the simple, uniform excise, specific excise tax. I'm going to leave it there, Patrick, and I thank everyone for their attention.
Merci beaucoup, Jeff, pour cette présentation. Donc, nous retenons que il ne faut pas seulement se focaliser sur les prix de cigarettes, mais il y a cet aspect d'abordabilité qui est très important. Il y a cet aspect de la structure fiscale que vous avez partagé avec nous. Et nous avons vu les scores. C'est très clair que dans les pays en voie de développement, il y a encore des efforts à fournir, alors que dans les pays très avancés, ils ont aussi des taxes très, très élevées. Alors, vu que nous courons maintenant derrière le temps, je vais inviter notre collègue Jeremias Paul à prendre la parole. Jeremias va nous présenter la deuxième édition du manuel d'administration des taxes sur le tabac. Jeremias, nous l'appelons souvent GP, affectueusement GP. Il est chef de l'unité politique fiscale pour la santé du département de la promotion de la santé au siège de l'OMS à Genève. Il dirige une équipe qui assure la direction stratégique, le renforcement de capacités, l'assistance technique spécialisée dans le domaine de mesures fiscales pour la santé, notamment en ce qui concerne les droits d'assises sur le tabac, l'alcool et les boissons sucrées. GP et son équipe sont les cerveaux du manuel technique de l'OMS sur la politique, l'administration des taxes sur le tabac lancé il y a très peu de temps. GP, vous avez la parole. Merci.
Thank you very much. If you can hear me, my presentation will be about the 2021 WHO Technical Manual on Tobacco Tax Policy and Administration, and what are its key takeaway messages. First slide, the second slide, please. So we've already heard, but still, I just wanted to reiterate that the tobacco epidemic remains a health, economic, and development issue. And that's one of the most effective, single most consistently effective tool for reducing tobacco use is raising tobacco tax. It kills 8 million people per year. The economic cost is 1.4 trillion, and tobacco use exacerbates poverty and inequalities. Next slide, please. As Jeff has mentioned, there's been a lot of documentation of the effectiveness of tobacco taxation, so I won't go into that, but certainly there are a lot of references on this. Next slide, please. So what is the 2021 manual? It helps essentially navigate tobacco tax reform. There was a 2010 manual, which Jeff was referring to, but this 2021 manual essentially reaffirms the tax policy design principles that maximize the impact of tax increases and improve tax structure. It has, we have also updated the compendium on best practices. What is new? There's evidence from low and middle income countries, country case studies, and a tobacco tax reform checklist. There's a discussion on the fundamental components of tobacco tax administration, because tax policy is only as effective as how it's implemented. There's a description of the tobacco industry scare tactics and how to counter them. And there's a discussion on taxation of emerging and novel tobacco products. Next, please. So we have here, essentially, if you read the manual, you have a snapshot of the several steps that you would want to do, as you navigate the tobacco tax manual, starting with what are you really trying to achieve, and you analyze the structure, what improvements are to be made. You assess the political economy of taxation and all that stuff, and all the way up to monitoring and evaluation of the tax increase or the tax reform. Next slide, please. So I'm going to divide the key takeaway messages into three components. One is the tax policy, but essentially from a big picture standpoint, the evidence from low and middle income countries reaffirms the effectiveness of tobacco taxation. The tax structure matters, and that the simpler the tax structure, the better. That you have to rely more on specific taxes to drive price increases. That was the point made by Jeff also. That you have to increase tobacco taxes significantly to reduce affordability. That you need to tax all products in a comparable way. Otherwise, if you don't, there's going to be a substitution effect. There's an incentive to substitute to relatively less expensive tobacco products, which may reduce the public health impact of the tobacco tax increase. And you need to impose excise taxes on new and emerging products. For example, heated tobacco products should be taxed at the same level as cigarettes. Can you go to the next slide, please? The second takeaway is really on tax administration. The manual says that we need to implement best practices in general tax administration to make tobacco tax administration more effective and efficient. It's really good to look at tobacco taxation implementation as part of the overall general tax administration, which means that you also need to ensure cooperation among the various agencies involved in the implementation of tobacco taxes. You need to oversee the whole tax compliance cycle, and you need to implement actions to facilitate control and enforcement. It would certainly help at the end of the day if you become a party to the FCTC protocol to eliminate illicit trade in tobacco products, or at least implement the best practices described therein. Next slide, please. The other point, a set of takeaways are really with respect to the political economy of reform. The technical part of tobacco tax reform is pretty straightforward, but going through the political economy is also a major issue to a hurdle. And tobacco industry scare tactics, in our experience, can certainly dissuade governments from implementing tax reform. What does scare means? It's really an acronym where if you increase tobacco taxes, you increase smuggling and illicit trade, you'll have court and legal challenges. There's A stands for if you increase tobacco taxes, you should not, because it's anti-poor and it's regressive. You should not, if you increase tobacco taxes, there's a risk or a danger that instead of revenues going up, there will be revenues will go down. And if you increase tobacco taxes, there will be a negative employment impact. Of course, evidence suggests that these are all exaggerated, but knowing these things, for example, in the case of smuggling, the tobacco industry really exacerbates or makes the problem bigger than it is. And we have documented cases that tobacco industry themselves were involved in this. So what is really important is that you need to improve your tax administration, because governance and other and tax administration certainly address these issues. So if you read the manual, you'll be forewarned what are the tactics of the tobacco industry, the scare tactics. You'll have examples there, case studies, and how countries essentially overcame the scare tactics. The other component of political economy is really the issue of earmarking. Although finance ministry officials, as a general rule, do not agree to earmarking. However, if there are particular circumstances allow it, well-designed soft earmarking of tobacco tax revenues for health can win public support. We have seen this in an increasing number of countries. And when I say soft earmarking, it still goes to the central fund, but the revenues from tobacco taxation are really, if you're doing a tobacco control program or you're doing something that's related to health, the soft earmarking certainly ensures that you have revenues for your health projects. For example, in the Philippines in 2012, they passed the sin tax reform of 2012, and they significantly increased tobacco taxes by about 341% in the first year. And the incremental revenues were going to be earmarked for universal health coverage. The increase essentially because of this substantial increase and the simplification of the tax structure in the Philippines, the budget for health, the Department of Health, increased by close to more than 3 times. And it also provided funding for the health insurance premium of the poor to allow subsidizing them. The next slide, please. Other key takeaways: there's a need to promote greater policy coherence across sectors. Countries where ministries of health, finance, and other ministries work together are more successful. This is important because it's really important that there's policy coherence, because on the ground you will see that many of the ministries have their own specific objectives. That's why it's really important that all ministries be on the same page. Tobacco taxation works best if implemented as part of a comprehensive package. You have the Empower package for tobacco control, and where R refers to raising tobacco taxes. So it's not only implementing tobacco tax on its own, but although it's the most cost effective, you have to work together in tandem with the other tobacco control measures. And tobacco taxation is smart. They save lives, they mobilize resources, they address health inequities because they essentially address the impact on the poor. They reduce health systems burdens because prevention is better than cure, and if you have a lesser incidence of non-communicable diseases, the burden on health systems in the future will be much less. And T is that it targets NCDC risk factors like tobacco use for the fulfillment of the SDGs. Next slide, please. So I would like to reiterate, read the manual. It's a useful resource to learn the theory of practice of tobacco tax policy administration. And tobacco taxation is really an underutilized policy tool in Africa. This was highlighted with Jeff, and highlighted also earlier by William. And certainly you can learn from the experience of other countries, because there are case studies to illustrate how particular countries responded to issues raised by the tobacco industry. Next slide, please. Yeah, just to show the point. Next slide, please. Prevention is better than cure. I mean, you need to essentially avoid the experience of the high-income countries, because if you look at the tobacco epidemic, normally there are stages. And the Africa region is really at the initial stages. So it's better to nip it to the bud, prevent, rather than have higher costs and higher deaths in the future. Next slide, please. In conclusion also is that do not be afraid of the scare tactics of the tobacco industry. You do your homework and equip yourself to anticipate and counter them. It will also be helpful to frame tobacco taxes as a health rather than a revenue measure. And when we're talking about tobacco taxation in the context of domestic resource mobilization, it's also important to know that revenue mobilization is not only about raising revenues, but spending wisely. And clearly, raising tobacco taxes not only raises revenues, but it's really a spending that will accelerate it's an NCD prevention accelerator. So if you want to include the taxes, since it's a smart thing to do, include this tobacco and other health taxes as an essential component of any country's medium-term revenue strategy. Next slide. I think that's the end of it. Be mindful also of the industry views. I mean, when you're doing this, you are really in a war with the tobacco industry, profits versus saving lives. And if you look at how the industry looks at the region, Japan Tobacco, for example, and British BAT look at countries in Asia and Africa as really exciting prospects for growth. Next slide. And if in the context of COVID, I mean, this is essentially research done by the Center for Global Development. Tobacco taxation can really hit the sweet spot in low and middle income countries post-COVID-19 because the study essentially looked at various options of raising revenues like the wealth tax and excess profit tax, digital services tax. And of course, they looked at tobacco taxation and alcohol tax and SSB. Clearly, there's room to grow for tobacco taxation. Okay, next slide, please. So in conclusion, don't be scared, be bold, go smart, tobacco taxes, because after all, health is wealth. Thank you very much.
Merci beaucoup, JP, pour cette très brillante présentation. Donc, JP est revenu sur la deuxième édition du manuel d'administration des taxes sur le tabac et nous encourage à utiliser ce manuel. Et il est revenu plusieurs fois sur l'interférence de l'industrie du tabac. Très clairement, il nous demande de ne pas avoir peur, surtout les pays d'avancer. Et il a donné l'exemple des Philippines. On peut mobiliser suffisamment de ressources grâce à la taxation sur les produits de tabac. Et dans ce contexte de pandémie à la COVID-19, nous pouvons utiliser justement une partie de ces ressources pour la reconstruction des pays, parce que beaucoup de pays ont été touchés aussi bien sur le plan économique. Alors, sans plus tarder, parce qu'il ne nous reste plus que 13 minutes pour ce webinaire, je vais donner la parole à mon collègue Noureiny Tcha-Kondor qui travaille pour l'OMS AFRO. Noureiny va rapidement nous parler des succès récents de la taxe sur le tabac en Afrique. Avant de rejoindre l'OMS, Noureiny a travaillé pour le ministère de Finances et de Développement au Togo pendant 14 ans. Il a travaillé aussi pendant quelques années pour l'Alliance pour le contrôle de tabac en Afrique. Noureiny, vous avez la parole. Merci.
Merci, chers collègues. Merci de m'avoir invité à cette réunion. Je vais être bref pour rester dans le temps. Nous avions l'habitude de présenter la Gambie comme un cas de succès presque permanent qui était dans le cheminement de l'Afrique du Sud, qui a été pendant longtemps le pays que nous présentions comme modèle en matière de fiscalité du tabac. Mais il s'est fait que dans les temps les plus récents, il y a un certain nombre de pays qui ont attiré notre attention et que nous voudrons présenter ici. Et donc, notre présentation se fera en 2 points, slide. Et donc, le premier point de notre présentation portera sur l'expérience du Rwanda et le deuxième point portera sur l'expérience de l'appui aux organisations économiques régionales, notamment la CEDEAO, la Communauté économique des États d'Afrique de l'Ouest. Slide. Donc, le Rwanda est un pays avec lequel nous nous sommes engagés en 1914 dans le cadre des travaux d'harmonisation fiscale au niveau de la Communauté économique des États d'Afrique de l'Est. Donc, nous voulions voir quel type de structure fiscale était mis en place par les différents États et nous voudrions aussi analyser de quelle manière apporter une certaine convergence dans la mise en œuvre des directives pour l'article 6 de la Convention cadre pour la lutte anti-tabac. Donc, nous avons remarqué que le Rwanda appliquait une taxation de type ad valorem pendant plusieurs années. C'était aussi le cas pour le Burundi, alors que les pays comme l'Ouganda, la Tanzanie appliquaient une taxation de type spécifique qui, malgré tout, comportait des catégories, ce qui n'est pas très bien dans le cadre de la bonne structure fiscale, et ça permet à des catégories les moins aisées d'aller vers les cigarettes les moins chères. Donc, il fallait regarder tout cet ensemble et voir quel type d'appui on pouvait apporter aux États spécifiquement. Et dans le cadre de l'appui spécifique au Rwanda, nous avons analysé ensemble les données sur les taxes, la politique fiscale pendant une certaine période, et nous avons analysé l'environnement de la politique anti-tabac dans le pays, slide, et ce qui nous a permis de constater que le Rwanda est un pays qui a une loi anti-tabac. La prévalence est relativement modérée, mais qui existe, qui mérite d'être prise en compte. Et la loi est en train d'être améliorée, notamment avec la mise en œuvre des mesures sur les avertissements sanitaires, la fiscalité sur les cigarettes électroniques et puis aussi les environnements sans fumée. Slide. On peut passer au slide suivant parce que, oui, donc, voilà. Donc, entre 2001 et 2014, le Rwanda a appliqué une taxation de type ad valorem. Et donc, dans cette lignée, ils ont eu des augmentations successives. Cette taxe a même doublé entre 2001 et 2008 pour aller à 120%. Et toujours dans la quête de revenus, cette taxe est allée à 150%. Les analyses qui ont été faites ont permis de remarquer que cela n'a pas un impact significatif sur les revenus, ça n'a pas un impact significatif sur la hausse des prix, parce que nous savons qu'une politique fiscale sur le tabac efficace est celle qui précisément réduit la consommation avec pour conséquence l'amélioration de la santé des populations. Donc l'analyse et les propositions qui ont été faites ont permis de changer la structure fiscale du Gabon. Donc à partir de juillet 2015, le Rwanda a mis en place une taxation mixte de 36% sur le prix de détail, ce qui représente une large base fiscale, et puis une taxation de type spécifique de 30 francs rwandais sur un paquet de 20. Donc, dans les slides que nous verrons prochainement, nous allons voir que cela a eu déjà un impact à partir de ces années-là. Et à partir de septembre de 2019, la taxation de type ad valorem a été maintenue, mais ils ont beaucoup plus compté sur la composante spécifique, comme les présentations antérieures l'ont proposé pour les États. Donc, une taxation de type mixte avec un intérêt beaucoup plus important sur les taxations de type spécifique. Donc, cela a été l'objet du deuxième changement dans la fiscalité du tabac du Rwanda, pardon, et nous allons voir dans le slide suivant les résultats. Donc, quels sont les résultats qui ont été obtenus? Donc, si vous regardez dans le tableau de gauche, entre 2010 et juin 2014, vous allez voir que les revenus ont fluctué et de manière en scie, et que à partir de 2015, de juin 2015, ces revenus ont pratiquement doublé. Alors, cela se retrouve pratiquement au niveau du graphique. À partir de 2015, la pente des coûts représentant les revenus sur les cigarettes importées et les revenus sur les cigarettes fabriquées manuellement, cette pente est beaucoup plus importante. Cela veut dire quoi? Cela veut dire que l'introduction de la taxe de type spécifique, comme l'ont recommandé nos collègues, a un impact beaucoup plus important sur le prix. Et lorsqu'ils devraient choisir la composante de type ad valorem, ils l'ont choisi en mettant l'accent sur le prix de détail et non pas sur la valeur CAF. Bon, il est vrai que cela suscite des questions en matière d'administration fiscale, mais jusqu'ici, le Gabon est arrivé à accroître ses revenus et en changeant significativement la taxe d'accise, en reposant sur la taxe d'accise de type spécifique. Regardons d'autres impacts sur le slide suivant. Donc, dans le slide suivant, vous allez voir l'impact des changements au niveau des quantités de cigarettes. On est allé un peu trop vite. Là, c'est l'impact sur les prix. Vous allez voir que là, c'est l'impact sur, s'il vous plaît. Donc, c'est l'impact sur les revenus, nous en avons parlé. Vous allez voir qu'au cours des années où il était mis en place une taxation de type ad valorem, c'est-à-dire de 2010 à pratiquement une partie de 2015, les revenus n'ont pas augmenté de manière aiguë. Donc, à partir de 2015, vous allez voir que la pente de l'augmentation des revenus fiscaux est beaucoup plus importante due au changement de la structure fiscale. Donc, ça, nous en avons déjà parlé et on peut évoluer vers le slide suivant. Voilà, merci beaucoup. Donc, il y a une réduction des quantités de cigarettes qui sont consommées localement. Donc, vous allez voir que cela a eu un impact sur la baisse de l'offre des cigarettes manufacturées localement à partir de 2015 jusqu'en 2020. Même s'il y a des petites variations, mais la tendance, c'est la baisse des quantités de cigarettes fabriquées localement due à la baisse de la demande des cigarettes. Slide suivant, s'il vous plaît. Voilà. Là, on s'intéresse au prix. On s'est intéressé au prix et on a calculé le prix moyen entre 2015 et entre 2013 et juin 2015 et que l'on va comparer au prix entre juin 2015 et 2019. Donc là, on remarque qu'il y a une hausse des prix de 50%, notamment pour les marques du Nil Light, du Nil FF et puis du Nil. Les autres marques, dont les plus consommées, Intore et Impala, ont augmenté dans des proportions aussi différentes. Donc, globalement, tous les produits ont connu une hausse en matière de prix nominal. Slide. Maintenant, on va essayer de regarder la part des accises dans le prix du paquet. Donc, la part des accises dans le prix du paquet, qui était du paquet de vin, de la marque la plus vendue, qui était de 17% en 2014, a plus qu'augmenté en 2016 à cause justement du changement de la structure fiscale et de l'augmentation, est passé aussi à 49% du fait du changement fiscal en 2019, qui s'est appuyé sur la composante de type spécifique. Donc, quand on compare avec les autres États qui ont des parts d'accise relativement élevées, on remarque que le chemin parcouru par le Rwanda a été assez important en matière de changement de la part du droit d'accise dans le prix du paquet de cigarettes. Le slide. Donc les autres éléments de transformation de la politique fiscale du tabac au Rwanda, nous avons aussi constaté que l'accessibilité aux produits du tabac, qui se définit par la part du revenu par habitant qui est consacrée pour l'achat de 2000 bâtons de cigarettes, cette accessibilité a diminué parce qu'il faut consacrer davantage de revenus pour accéder à 2000 tiges de cigarettes. Donc, le Rwanda applique les timbres fiscaux et puis il est dans un processus de mise en place du suivi et traçabilité des produits du tabac. Ils ont adopté le protocole et la ratification est en cours. Pour finir, slide. Donc, le deuxième aspect de notre présentation porte sur les progrès accomplis dans les organisations régionales. Et celui que nous avons choisi, c'est la Communauté économique des États d'Afrique de l'Ouest, que nous appelons ECOWAS. Donc, au niveau d'ECOWAS, des travaux avaient débuté dès 2012, notamment dans le cadre des recherches universitaires, qui ont abouti à des propositions de directives et avec l'appui de l'OMS, ils ont été capables de changer la structure fiscale de 2017 qui prévoyait une base de 15% et un maximum de 100%. Ils l'ont changé en ayant une base mixte de 50% avec une composante spécifique de $2 par tige de cigarette, de 0,02 cents par tige de cigarette, et puis il n'y a pas de maximum, donc il n'y a pas de plafond, alors que précédemment il y avait un plafond. Donc cette base est de type mixte, mais je dois vous souligner que la Gambie applique une taxation de type spécifique uniforme et la Gambie n'a pas l'intention de changer sa structure fiscale. Et la Gambie augmente progressivement ses droits d'accise, et ce qui lui permet d'accroître ses revenus. Bon, maintenant, au niveau des autres États de la CEDEAO, on a un pays comme le Cap-Vert qui a transformé sa politique fiscale pour la rendre conforme aux recommandations de la CEDEAO et qui applique justement une base minimum de 50%. Avec une taxe d'actifs de type spécifique qui correspond au minimum de la CEDEAO. Maintenant, le Nigeria a réformé sa politique fiscale aussi. Ils ont une taxation de type mixte, mais le Nigeria doit augmenter sa taxe d'accise de manière à la rendre conforme au minimum de la CEDEAO. Les autres États de la CEDEAO qui sont francophones, il y a 8 États francophones qui sont membres de la CEDEAO et ils mettent en place une politique fiscale qui est beaucoup plus basée sur la directive de l'Union économique et monétaire ouest-africaine. Et cette directive est une directive qui prévoit une taxation de type ad valorem uniquement, mais l'intérêt c'est que la base fiscale qui était de 15% a été portée à 45%, et à 50%, et le maximum qui était de 45% a été porté à 150%. Cela veut dire qu'il navigue à l'intérieur d'une certaine marge. Et en naviguant à l'intérieur de cette marge, certains pays comme le Sénégal, le Niger, le Togo et le Bénin sont arrivés à augmenter leur taxe d'accise. Mais comme nous l'avons dit précédemment, il est préférable de mettre en place une taxation de type spécifique, sinon une taxation de type mixte, comme le recommande la directive de la CEDEAO, qui est plus proche de ce que recommande l'article 6 de la Convention cadre pour la lutte anti-tabac. Donc, en termes de résultats, nous allons voir en termes de résultats ce qui a été obtenu sur le slide suivant. Donc, au niveau de la CEDEAO, la part des accises dans le prix du paquet est passée de 10,7% à 19% pratiquement. Et donc, l'accessibilité aux produits du tabac s'est relativement améliorée dans 8 États. Maintenant, le problème, c'est qu'on est loin des 70% qui sont recommandés dans le cadre du manuel de l'OMS. Donc, il y a une marge que les pays peuvent remplir, y compris le Rwanda, qui a quand même une part d'accise de 49%. Cette marge peut être remplie à travers des augmentations progressives, successives pour le Rwanda, et à travers la mise en place de la directive de la CEDEAO, l'utilisation de la directive de la CEDEAO par les États, par l'ensemble des États de la CEDEAO, et y compris le Nigeria, dont les standards ne sont pas encore à ceux qui sont recommandés par l'organisation régionale. Maintenant, quels que soient les progrès accomplis dans tous les États, le commerce illicite reste un problème, et donc il est important que les États ratifient le protocole pour l'élimination du commerce illicite des produits du tabac. JP l'a souligné. Il y a aussi la nécessité d'actionner les mécanismes multisectoriels pour faire un suivi de l'industrie du tabac. Pourquoi? Parce que lorsque le Covid est arrivé et les économies ont été frappées, les États ont mis en œuvre des mesures pour supporter l'économie dans son ensemble. Mais on n'a pas discriminé l'industrie du tabac. L'industrie du tabac, malheureusement, dans certains pays, bénéficie des réductions fiscales pour pouvoir faire redémarrer l'économie. Donc, nous pensons que un suivi régulier, un processus multisectoriel qui met en œuvre le travail des groupes techniques, mais pas seulement des groupes techniques, mais qui va au-delà pour intégrer les parlementaires et qui intègre aussi les organisations de la société civile, peut faire un meilleur suivi pour éviter que les mesures progressives qui sont prises ne soient mises en cause parce qu'il y a une crise sanitaire qui impose de supporter l'économie pour relancer la croissance. Je vous remercie beaucoup pour votre attention et merci à vous tous. Je crois que j'en ai fini.
Merci beaucoup Noureiny pour cette très belle présentation. Et donc, nous avons eu des exemples concrets dans les pays où comme le Gabon, le Rwanda et la Gambie, où il y a eu des progrès grâce à l'appui notamment de l'OMS AFRO. Très rapidement, parce que nous avons dépassé le temps, je vais vous demander juste d'être patient avec nous. Nous étions censés terminer à 15h15. Je vais vous demander de nous accorder encore quelques minutes. Nous allons aller rapidement, donner la parole à notre collègue Zunda, qui est chercheur à l'université de Cape Town. Donc, Zunda travaille sur l'économie dans le cadre de la lutte anti-tabac depuis plus de 5 ans. Il fournit un appui technique sur la taxation de tabac au pays. Et donc, Zunda, vous avez la parole pour nous parler de l'appui que vous fournissez au pays. Allez-y, vous avez la parole. Merci.
Okay, thank you very much. I realize time is not really on our side. So mine is going to be really a very short presentation. I thought I'll just give a short presentation on some of the additional support and avenues of support that governments may have in terms of, anything to do with the economics of tobacco control, ways to improve taxation in their countries. Next slide, please. Okay, so just as a kind of quick backdrop, so we know that parties are already committed to, improving public health through their commitment to the WHO's FCTC. And one way to do this is basically to ensure that they localize legislation and policies are improved and implementation and enforcement at the local level. The other thing that we know of is a lot of the information that we've received already really has to do with resources that are available, such as the Article 6 guidelines, which draws from lessons from global evidence and mirrors best practices from several others across the world. Next slide, please. So we're basically the Knowledge Hub. Sorry, previous slide. So we're basically the Knowledge Hub on tobacco taxation and illicit trade. It was launched in 2018 at the World Conference on Tobacco Health. We're based at the University of Cape Town, and we're really part of the research unit on the economics of excisable products. Many of you may have known this as the economics of tobacco control. And our mandate is essentially to support parties to the FCTC in the areas of taxation and illicit trade. Next slide, please. So how do we go about this? Basically, firstly, we provide annual workshops or biannual workshops where we basically provide information on how to design efficient tobacco tax systems. We provide information on how to measure the size of illicit trade. And we also do a lot of modeling, right? So government's often interested in trying to figure out how do you measure the impact or likely impact of excise tax changes on things like tobacco consumption, smoking prevalence, and tax revenues and these sorts of things. And over the last 2 years since inception, we've basically been able to reach roughly 30 countries. Sorry, just excuse me one quick minute. Sorry about that. So basically, we've been able to reach roughly 30 countries since inception. We typically have 2 participants from each country, and we've got one person from the Ministry of Health and a person from the Ministry of Finance. We've also got one workshop that's coming up in August, and basically this is going to be provided virtually. So if you want more information on that, I'll have some email addresses for you to get in touch with us. Next slide, please. The second way that we provide assistance is through technical assistance. And what we do here is basically we have country-specific tailored support. So in the workshops, usually this is a group setting, so you're not able to provide one-on-one or complete one-on-one support. But technical support or our technical assistance allows for us to tailor our responses and our support to a particular country context. We aim to obviously build capacity within the countries and help governments and civil societies to address their specific needs. Some of the countries that we've been able to provide support in this regard listed over here, and I just highlight some of the countries we've got within the African continent, so Mauritius, South Africa, Nigeria, Chad, Burkina Faso, and Sierra Leone. Next slide, please. Third way, and this is the final one, is basically through knowledge dissemination. So we've developed what we call the e-library, which is the first of its kind resource of over 1,800 entries on articles to do with tobacco taxation. And what this does is basically it's a resource that has been collated and curated in a way that anybody that has access to this can basically search information either on region, in terms of demographic groupings, so youth versus other groupings or general population, and just and get access to different articles that speak to tobacco taxation in that specific respect. But these are generally, academic articles. So sometimes one way in which we are able to break down that information is by developing policy briefs, and we have what we call a Back to Basics series, which is in both English and French translations, and basically allows, basically breaks down a lot of the technical components of what has been presented in journal articles into a more digestible sort of avenue for people to be able to understand the complex tax issues. And then finally, through this quarterly newsletter, which is a newsletter that's provided by the broader REAP community, and basically we're able to provide information on what's been going on in this community. Next slide, please. And just a quick note on some of the research that we conduct. So we're not just interested in providing technical support, but we're also conducting various types of research and generating additional knowledge in areas of gaps that need to be filled in this area. So we have some work going on in West Africa currently that's really complementing a lot of what's been spoken of, I think, by Noureiny. We've also got some work going on the Global Alliance on chronic diseases. And basically this has to do with tobacco packaging, as well as tobacco taxation, and trying to understand the linkages between the two. And then we also have some work going on trying to collate data and make it more presentable in a way that's user-friendly and usable by people that are interested in that information, both at the policy level and amongst researchers. And then just to note that we're obviously working with several partners. I can't mention all of them here. I'll definitely leave some out, so I won't be able to mention everybody, but we're working within a very interesting ecosystem, and we just acknowledge the fact that there are several other players at work in this environment, and we're happy to partner with them as we go forward. Next slide, please. Okay, so for any additional information, I've put some slides, some websites over there for you to get in touch with us. And my email address is at the bottom there. Thank you very much.
Merci beaucoup Zunda pour cette brillante présentation. Donc Zunda, comme il a dit, travaille pour l'Université de Cape Town et il nous a donné plusieurs exemples démontrant qu'ils sont disponibles. L'Université de Cape Town est un centre de connaissances qui collabore avec le Secretariat de la Convention 4. Ils sont spécialisés dans la taxation sur le produit de tabac et le commerce illicite de produits de tabac. Alors, je pense que j'ai fini la tâche qui m'avait été assignée aujourd'hui. Et donc, nous allons passer, après toutes ces brillantes présentations, nous allons passer à l'étape suivante. Très rapidement, je vais donner la parole à Jeff qui va nous guider dans la session dédiée aux questions et réponses. Et puis, nous allons sûrement avoir un débat modéré. Et puis, Jeff va clôturer cette réunion. C'était un plaisir pour moi de modérer cette première partie. Je vous dis merci et à très bientôt. Jeff, vous avez la parole.
Thank you so much, Patrick. And I'm going to encourage my panelist colleagues to come back on video. We're running a little bit late. I first wanted to thank from the bottom of my heart our interpreter, Jean-Pierre, who we had some specific issues with the Zoom interpretation panel today, and he has done this by himself. This was a Herculean effort, and he's done a splendid job. So thank you very much, Jean-Pierre, and we'll be talking to our Zoom subscription people to find out why it wouldn't add the second interpreter who's been waiting in the wings, but Jean-Pierre has done a marvelous job. I know we're running a little bit late here, but I did want to bring something up to my panelists because I have them here and they're also learned and are living this reality every day. And just very simple question or two-part question. And one, in our experiences here at University of Illinois at Chicago, we've been working in many countries, and we thought honestly that COVID-19 would be this amazing opportunity where, you know, governments would be knocking on our doors saying, hey, we need your help. We really recognize this is bad. This tobacco epidemic is bad. We need your help. We see that tobacco taxation is a great strategy. Come help us. And so we haven't seen that. In fact, you know, it's been much more limited, and in fact, some places have pushed back in the opposite direction. And so, my first part of the question is, why do you think that's happening? And perhaps what are you seeing in Africa? And then the second question is, how do we reinforce with our colleagues in government that this really is the strategy that we need to undertake? This is a really important critical juncture, if you will, in human history. And I think tobacco taxation offers us a wonderful opportunity. So I'm going to open the floor to my esteemed colleagues and see if they have anything to add here.
Maybe I can begin, Jeff. I agree. I have the same question, but I think it's a question of when rather than if they will. Right now, governments, there's a political economy side of things. It's most governments are still attending to to address the COVID-19. I mean, some are still in lockdown. So putting things in lockdown is politically challenging. And now if you add another tax increase, that really won't. So it's a matter of framing this. I asked some of my colleagues in the Ministry of Finance, and they say, if you frame it as part of COVID response, we may be able to get it, but right now is not the time because it's very difficult to sell politically a tax increase. But even Euromonitor, one of their publications, said that it's the tobacco industry is expecting a tax increase. It's not if the tax increase will happen, it's just when. And that's why they're also they're doing a preemptive move, essentially blaming illicit trade, blaming other things, especially illicit trade, for the reduction in if there's just a reduction in revenues. But there's also one angle which which cannot really be proven empirically, is that if you're in the Ministry of Finance and your key result area is increased revenues, and if the tobacco industry offers you guaranteed revenues in exchange for not doing anything, then you'll certainly be tempted to take it. And I can relate to that because in my previous life, they were, and so it's really important that this message come out. But clearly, it's just a matter of time and how to frame this, because when the dust settles, I mean, and with a lot, especially in Africa, there's a lot of debt, and you have increasing debts and declining revenues. Where do you go? I mean, sooner or later, there has to be fiscal consolidation anyway.
Thanks, JP. I think those are wise words. And for those on the webinar who don't know, Jeremias Paul was the Assistant Secretary of Finance in the Philippines and was really in the thick of this. So he knows these things from a very personal perspective. So it's a very rich commentary. Thank you. Zunda or Noureiny, Dr. Maina, anybody else want to weigh in on this one?
Well, I could start. Yeah, look, I completely agree with JP's assessment. I think it's really just a matter of time at this point. So, I mean, if a lot of what you've presented from the tax scorecard in terms of progress made, and what I think it was Dr. Maina's presentation as well, if anything, if that's anything to go by, I think the question is really a matter of when when the governments are likely to sort of start being more receptive to changes and increases in tax revenues. So I think it's really a question of seizing the opportunity when it arises and framing it in such a way that that I guess speaks to what I would probably put as a sort of post-COVID a post-COVID recovery option. I think would be one way to put it. I think, yeah, that would be my 2 cents on that.
Thanks. And Noureiny, I think you want to say something.
Yes, thank you very much. I agree with both, but we need also to look at the perception of the tobacco industry in countries, because in countries where industries are not so much developed, the tobacco industry might be perceived as a sector for development, unfortunately. And I think the role of civil society organizations in raising awareness on the nasty role of the tobacco industry is very important. If decision makers have their awareness raised before the COVID, I don't think they will not go for tax exemption, because there is the one side of the problem, which is how to get more revenues, but there is another side, how to avoid tax exemptions, putting in front the recovery of economics. We need to struggle on both sides, increasing revenue and preventing tax exemptions. But to do both, we need more of an awareness raising among decision makers. Thank you.
Thank you, Noureiny. Those are wise words, and I think you're absolutely right. These are really great inputs from all of you. Dr. Maina, did you have any last words? I think we're about time to wrap up, but I'm going to give you the last word if you would like to take it. I know you're in the thick of these things as well. Nope, I think we might have lost Dr. Maina. In any event, I want to thank everyone. I want to thank our esteemed panelists today for joining us. I'm so delighted to be here with all of these folks. I admire very much and are really in the trenches fighting this battle, and I'm grateful for their colleagueship. I'm grateful to all of you for attending. We are going to post this on the tobacconomics.org website so that you can view it, and please pass it on to your colleagues. I think there was a lot to learn today from our colleagues, and I'm grateful to them for sharing their experiences. I think the last word I'm going to leave is actually to pick up on Zunda's presentation. There's a lot of help available, and there's no excuse, I guess, is my final word here. We have so many resources available. We have the UCT Knowledge Hub. We have Jeremias Paul and his team in Geneva. We have Noureiny and Dr. Maina here in Africa. We really have these resources and people who are raring to go to help. All they need to be is asked. We are also a big resource here at UIC. Please visit our website. We have an enormous number of resources on there as well. We don't work as much in Africa because my colleagues do so much work there. We don't want to duplicate, and there are many regions in the world where we need to do this important work. But I really want to emphasize that the help is there. And so I encourage you to seek it, and I think you will be very pleased with the quality of assistance that you will be given. These are high quality economists here on this panel. So again, thank you so much to everyone for joining today. Thank you, panelists. Thank you, Jean-Pierre, for wonderful translation. You are a hero. I know how exhausting it is to translate for an hour and a half. You've done an amazing job. I hope everyone has a wonderful evening, and I look forward to seeing you all again soon. Thank you.